during the World Bank IMF spring meetings. I happen to also be part of the meetings, and I will say that the respect that His Excellency Mr. President Bola Ahmed Tinubu, GCFR, has earned this country by his steady hands in the face of huge difficulties, I think is widely appreciated and has created a space for us as a country to navigate through whatever difficult circumstances that we have, and to double down and translate the dividends of those macro-fiscal reforms into tangibleness for the Nigerian people, which is the direction that the President has given us. In the health sector, today, Federal Executive Council considered two items that were relevant to health. One is on the national health security, which is a core pillar of the Health Sector Renewal Investment Initiative. Last year, you recall, we had a massive cholera outbreak. Mr. President, in his wisdom, constituted a cabinet committee comprising 10 ministers across sectors to work together to control that outbreak. The cabinet committee submitted its report to the council in anticipation of the next cycle. Essentially, we've seen 18,700 people have been confirmed to have had diarrheal disease due to cholera in 2024, but 80% of them were in 9 states. And with the efforts that have been put in by federal government, by states, by National Center for Disease Control, we're able to bring that outbreak to a close. Of course, there were losses of lives, but we've learned some important lessons, including the need to continue sensitizing our population through states, local governments, to pay attention to open defecation, to clean water, basic sanitation, and position commodities so that when outbreaks such as cholera occur, which are likely to occur with the onset of rainy season, with flooding of water sources, we could see resurgence, because every year during the rainy season, that's when cholera really re-emerges. But if we are prepared, then we can be able to stem it and prevent losses of lives. So it's important that all state governments begin to prepare, improve their surveillance, preposition commodities, train health workers, and for the federal government, we're doubling down. So learning from 2024, we're getting in 2025 with really a very clear eye in terms of what challenges may be based on what we experienced in last year. This is part of Nigeria's effort to strengthen its health security. When disease outbreaks occur, we have to rally quickly to test it, identify it, and control it, whether it's cholera, whether it's meningitis. So Council was able to look at the note coming out of that cabinet committee. The second element is to advance the effort to transform Nigeria's health system. The Federal Executive Council approved the contract to construct major infrastructural projects at the Federal Medical Center in Makurdi, in Benue State, at the new permanent site, which is in Apir, in Benue State. And that is infrastructural upgrade to make that transition from the Federal Medical Center in Makurdi itself to Apir. As you know, the federal government is investing heavily in the primary healthcare system alongside the states, but the secondary and tertiary facilities are also important. Secondary facilities are in the realm of the states, but tertiary facilities, federal medical centers, teaching hospitals are where we train health workers, provide high quality referral services. And revamping those infrastructures is so key to the health sector transformation that Mr. President has directed us to undertake. So this contract that was about is one more in that direction to revamp and strengthen the federal tertiary hospital infrastructure, in this case in Makurdi, Benue State.